What I would like to do is take a little bit of a survey so I can understand who's in the audience. Are there any former or current Shearwater Health employees in the audience? If you are, just raise your hand. I know we have some current employees. Any former and current? Okay, some employees in the back. For everyone that's a nursing student, what I'd like you to do is stand up, if you don't mind. And the reason I'm asking you to stand up is because Shearwater Health is very focused around talent development and creating opportunities for nurses in the Philippines and also globally. Now, the interesting element is that nursing, traditionally, a lot of people have thought about nursing as being bedside and patient care. But there's a whole other industry called outsourcing and healthcare informatics. And that's some of you may have participated in the program that we held in December around educating you all on healthcare informatics. Stay standing. But what I wanted to do is, for those of you that have an interest in pursuing bedside, you can sit down. If you've made that decision yet, you can sit down. Nobody sat down. So does that mean that you all are evaluating career opportunities, right? You don't know if you want to go bedside and you don't know if you want to go to healthcare informatics. That's a great response rate. And that's what Shearwater Health is all about, is we want to provide opportunities for nurses to go in both career directions. The outsourcing industry we created in 2009, which we refer to as clinical process outsourcing, at that point in time, nurses that went to school here in the Philippines, all they thought about was bedside care. Well, now there's this whole other industry that we're the pioneers for, and we'd love to have you all join us, either bedside or outsourcing. You have that career option now because of organizations like Shearwater. So I appreciate you guys responding to that question, and the response rate is very telling for us as an organization. So you can all now sit down. Next group of attendees, if anyone who is a Philippine licensed nurse can stand up. Not a US licensed nurse, just a Philippine licensed nurse. Wow, so we have about 40-ish back there. So you are all probably currently employed by an organization. It could be a hospital, it could be an outsourcing organization. What I'd like to do is, everyone, we should give the USRNs and the Philippine licensed nurses a round of applause right now. The reason being is you've made the commitment to the nursing profession. You invested in your career and you see the opportunities, but also today is March 3rd, which is Employee Appreciation Day. And that's why I wanted to acknowledge all the employees that are out there today in terms of your commitment to the nursing profession and healthcare. For the Filipino nurses, what I'd like to do is ask you a couple questions, and we're going to keep it to US or Philippines. But how many of you have a desire or goal to pursue a career in the US? Raise your hand. So about 50% of you have a career goal of moving to the US. Now, of those, how many of you have decided that you want to pursue bedside or CPO, which is the outsourcing sector? Have you thought about whether or not when you're in the US you want to pursue one of those careers? If you have bedside, raise your hand. It's a less number. Isn't that amazing? That all of you, some of you might be practicing bedside right now, but want to actually migrate into the outsourcing sector in the US. And so again, I think this is a very telltale trend that we're seeing with everybody that's attending. Healthcare informatics is very important. It's an attractive market and a career opportunity for all of you. So for those, one more question for the Philippine licensed nurses. How many of you want to pursue your NCLEX at some point in advanced licensure? Yeah, 60-70% of you. Fantastic. Thank you. You can all now sit down. Now, I think we're going to have a smaller population. I don't even know if we'll have anybody stand up, but hopefully we'll have at least one. Is anybody here a US licensed nurse? The lucky one. Is it just one that stood up? And some people in the back? Okay, so we have more than one. Okay. For this group, for your career goal, do you plan on staying in the Philippines or going to the US? If you stay in the Philippines, raise your hand. All of you want to pursue a career in the US, is that correct? Raise your hand if you want to pursue a career in the US. Yeah. Do you have an existing priority date? So have you filed your visa petition? If you have, raise your hand. So nobody has. Okay, fantastic, you can sit down. Thank you all for participating in that. So let me take that kind of that data that we just gathered as part of this summit and talk to you a little bit about Shearwater Health and the history of the organization, because I think it helps put a perspective in terms of what's happening in the nursing community from a global perspective. And so first off, Shearwater Health, we started our roots in the Philippines back in the 1970s. And so we've been employing nurses for 45 plus years in the Philippines. And the way we had a business model back in the 1970s and 1980s was that we were a part of a for-profit hospital system in the US called HCA. HCA is the largest national health system in the US. And they had a strategy to expand internationally. And when they did, they relied on this business unit. At the time we were called HCCA International, but now we rebranded to Shearwater Health. They relied on this business unit to identify global nurses and have them migrate into different areas where HCA was opening up hospitals, primarily in the Middle East. And we saw that there was a great clinical talent pool in the Philippines. And so our presence started way back in 1975 when we were sponsoring nurses and moving nurses from the Philippines up into the Middle East to practice in a bedside capacity. We operated in that model for about 20 years. And then in the late 1990s, we saw an opportunity that the US was experiencing a significant nursing shortage. And we decided to pivot the business model from staffing internationally to actually recruiting Filipino nurses and sponsoring them for their visa petition or their employment-based green card to come work in a bedside role in the US. And we started that model in the late 1990s and ran it for a decade and had great success. We had partners like Wake Forest Medical Center, Duke University. They were clients of ours back in the 2000s timeframe. The Philippines was great from a nursing perspective. Everyone's educated in English, you understand technology, you have critical thinking. The Filipino nurse transitions very well into US healthcare from a patient care perspective. But we saw a trend occurring in the industry in the late 2000s, and that was that a lot of nurses that we were bringing to the US were not interested in practicing patient care for the long term, bedside patient care for the long term. And that's when we said we have these relationships with the Filipino community, the healthcare community. How can we leverage those relationships to create an outsourcing organization focused on clinical workflows? And that's when in 2009 we started up our clinical process outsourcing division. And today, fast forward to where we are today, our organization sponsors nurses from 35 different countries to come to the US. The US opportunities are both bedside opportunities and outsourcing opportunities. We have north of 4,000 employees here in the Philippines. Again, 90% of them being nurses. Opportunities in the Philippines are primarily in the outsourcing sector. And so we've experienced great growth over the last decade. But what's interesting from an organizational perspective is that the growth for the next decade is going to be even more attractive from an employment opportunity perspective. And so the industry trends right now are very concerning from a healthcare perspective. What you hear a lot about is a nursing shortage in the US. There is a severe nursing shortage in the US. Healthcare has been impacted. We've had to shut hospitals down. We've had to shut beds down, different units, because we have a nursing shortage. And what has the US healthcare organizations done? They've turned to the Filipinos to bring nurses into the US. We've been doing it for 2 decades. It's worked well in the environment for the past couple decades. It's not working well right now. The reason why it's not working well, in my opinion, and this is not the industry opinion, but this is my opinion, is because we've pulled too many nurses from the Philippines into the US. And for the first time in decades, the Philippines has a nursing deficit. We were just talking this morning that there's an article recently that discusses the Philippines needing 250,000 bedside nurses to get to an appropriate staff ratio. And so I bring that up because our mission is to improve healthcare outcomes globally. We're not just thinking about the US, we're thinking about the Philippines, we're thinking about other countries. How can we provide opportunities for all of you and help you pursue your career goals and objectives? Some of you might want to go work in the UK. Some of you might want to work in the Middle East, Australia, New Zealand, Canada, US, stay in the Philippines. Shearwater Health wants to be your platform so you could execute on your career goals and objectives. And so it's an unfortunate time for the healthcare industry here in the Philippines because we are in a deficit. And so what we've done now is we're very focused from an organizational perspective on talent development. And the industry needs to think about this. The goal for the outsourcing industry is that we want to grow from 1.5 million people today, employees, to 2.8 million employees in the next 5 to 6 years. That's a significant increase. The industry grew 8% by headcount last year. How are we going to accomplish this? We're going to accomplish it by talent development. And that's what I go back to. All the FEU students, you're all here. You have an interest in the outsourcing sector. You guys will add to that growth. There's growth opportunities for you. The Filipino licensed nurses, you have a career goal as well. You want to advance your licensure, take on additional roles. You'll add to the growth of the healthcare sector here in the Philippines. Then USRNs, you can stay here in the Philippines or you can migrate to the US. Again, you're trying to reposition yourself to solve for the global shortage from a nursing perspective. And so we're very excited about the opportunity. But our excitement is around how do we build the capability and build the talent pool. And what you're going to hear about today from our career coach, Tofit, in just a couple minutes, is some of those different programs that we've launched. But I want to just highlight a couple because I think they'd be of interest to some of you. For you students, you all attended, some of you might have attended the partnership we did in December where I think we had a couple hundred, 600, 700 FEU nursing students come into Shearwater and understand more about healthcare informatics. It's a great program. We want to try and figure out how can we embed the outsourcing or HIM curriculum into the nursing universities. So when you guys go to nursing school and you're ready to graduate after 4 years, you're not thinking about just bedside and have a whole new industry to learn, which is the outsourcing industry. We want to get that curriculum into the second and third year of the nursing school, so therefore you're going to be more successful when you graduate. The opportunities will be more for you. There'll be more opportunities for you to evaluate. And so I think that's going to be a really interesting opportunity for all of the universities to partner with organizations like Shearwater that want to increase the talent pool and change the educational curriculum from a traditional bedside model to more of an outsourcing model and bedside, and you dictate your career path after you graduate from school. We're very excited that we've launched 2 partnerships so far. We've launched the FEU partnership on the HIM curriculum, but we've also launched 2 additional partnerships, one with University of Cebu and the other with St. Jude College. And these programs are meant more for nurses that want to pursue bedside as opposed to outsourcing. And what we've done with these programs is that we're actually providing scholarships to 4th-year nursing students. So we're paying for 100% of the tuition for the 4th-year nursing students. In exchange, what we're asking the nurse to do is commit to working in a Philippines-based hospital for 2 to 3 years post-graduation. So what we're doing is we're subsidizing the tuition, and in exchange, we're increasing the number of nurses that are practicing at the bedside here in the Philippines, and we're trying to bring solutions to the 250,000 shortfall that's currently in place for the Philippine healthcare community. Now, after that 2 to 3 years, what's going to happen in that 2 to 3 year journey is Shearwater will sponsor you for your visa, and so you'll have the opportunity to go work in the US if you so desire. And so it's a longer-term career opportunity and commitment between Shearwater and our employees that have a desire to pursue bedside in the States. And so again, we're solving for the shortage from a Filipino perspective while also creating opportunities for US-based bedside nurses. And the best part of it is we're creating a more financially attractive opportunity for nurses to enroll in nursing school. We have to drive up the number of nurses that are enrolling in school. So if you look at the past trends for the last 12 to 14 years, back in 2013, we had in the Philippines close to 80,000 nurses taking the local nursing boards. You know, right now, we're at around 35 to 40,000. It's been cut in half. It got as low as 20,000 in the last couple of years. Now, the number of takers has decreased significantly, but what's very attractive and very promising from my perspective, the pass rate has gone from 40% to 75%. So the educational system is improving. We're graduating more qualified nurses that are having better success passing the nursing boards. So now when I check into the hotel that I stay at here, and I go up and I check in, and the nurse says, "Who do you work for?" The employee says, "Who do you work for?" I say, "Shearwater Health," and she goes, "Oh, I'm a nurse," but she's practicing, as a receptionist at the hotel, probably because she did not pass the exam. And so it's very promising to see that trend of the percentage increasing. And that's what we're doing from a talent development perspective at the university level. The other element that we're doing that Tofit will talk about is around the Scholars Academy. what we want to do is we want to underwrite your cost to pursue advanced certification. That advanced certification could come in the form of US licensed nursing, so you pass the NCLEX, or it could come in the form of passing coding certifications, more on the healthcare informatics side. And so Shearwater has programs in place for both, where we sponsor and underwrite all the costs for you to advance your career. It's been a great program. Our NCLEX Academy has about 70% passing rate compared to the industry average of 45% for first-time takers for international takers of the NCLEX. Our Coding Academy has 90% passing rates. So if you want to pursue a career path of additional certification, additional licensure, Shearwater has that platform, and we're going to continue to invest in that because that's developing the talent pool. It creates an employee-employer relationship that is much better than continuing to rely on market to hire. The last opportunity that we'll talk about is what we refer to as our Nurse Compass program. And that is for individuals that are currently employed by Shearwater Health that want to pursue US placement. Or they might want to stay in the Philippines and just continue their career path and move up the corporate ranks. What we've done with the Nurse Compass program is provide the opportunity for all of you to influence and really dictate what your career path is with Shearwater. And if you want to stay in the Philippines and continue to practice in the outsourcing sector, we pay you retention programs, retention awards for every year of service that you remain with Shearwater. If you want to move to the US, we file your visa petition and pay for all your transitional costs to go to the US to practice in either a bedside or a CPO opportunity. And so again, that's who Shearwater Health is. That's how the industry has to start thinking about this global issue, which is the nursing shortfall. The World Health Organization has estimated the shortfall to be between somewhere between 3 to 5 million nurses globally. And so organizations like ourselves have to look to partner with universities, partner with our employees. We have to be more strategic around how can we increase the number of nurses. The need is there. It's not going to solve itself. And I know Ansha mentioned a career fair at the end of this. I hope we have 120 new applicants that want to come work for Shearwater Health after you hear a little bit of the story this morning. So thank you all again for your commitment, and thank you for taking some time to hear the summit today.